Hi everyone, welcome back to another video. And first off, I don't know why my voice is so deep today, but I am really enjoying this gender euphoria. And yes, I am pre-testosterone. But anyway, today we're going to be talking directly to my colleagues in the medical community, because a lot of my videos have been from the medical community to the trans community. And I thought, let's do some videos from the trans community to the medical community. So today we're going to be talking about how to ask a trans patient about their medical history, because obviously we take medical histories on our patients every single day, and it can be kind of confusing how to navigate a medical history while maintaining somebody's dignity and respect if they are trans. And I just also want to clarify that I am just one trans person. I do not speak on behalf of the entire trans community. So any of my advice today is what I would want to see from my provider. However, other people may have other feedback that they would give you. And so just take this as the way that I would want to see a provider. And also with my experience in the medical field, I think I serve as a good bridge between the two communities, but this is not an end-all, be-all thing. People have different ways of asking questions that work for them, and so find what works for you, but these are just my tips that I'm going to be giving you today. So a lot of these questions can actually be asked to everybody. So especially starting off with the name and their pronouns, this is probably the most important part to get right in somebody's history, because obviously we want to build rapport and we want to build trust with our patients. And if you mess this up, this can be a huge miss. If someone messes up my preferred name and my pronouns, I'm probably not coming back to them. So keep that in mind. This part up here is really, really important. Include it on all of your intake forms. Make sure that you are intentionally using somebody's preferred name and their pronouns, because I promise you that will go a long way with your patients. So of course, for identity verification reasons, you would need to ask their legal name. Put that on your intake form. Maybe when you walk in the room, of course, have them verify their name and date of birth. But then after that, just don't even reference their dead name. Don't go back to that. Don't use that in front of the patient. If you do slip up, let's say you accidentally use somebody's dead name in front of them, or you use incorrect pronouns, correct yourself immediately. Apologize. Switch to the correct terminology, but don't just pretend that it didn't happen, because we remember. I promise you, we will remember if somebody didn't take the time to correct themselves and use the correct name with me. So legal name, this is often referred to as someone's dead name. So just put dead name, Smith. So yeah, don't really go back to this. No real reason to start using that with somebody. Preferred name, of course, you put the name that they want to go by. So when you walk in the room, you can ask them, what do you prefer to be called? And that's something, even in my medical education, they told us right away, ask every single patient, what do you prefer to be called? And then along with that, ask them their pronouns. A lot of the older generation might not understand what you mean when asking about their pronouns, and that's okay. You don't need to hammer it into some older person that doesn't understand. Just kind of move on there. But for somebody who does have preferred pronouns, this is a really meaningful question to ask. So be sure you ask that. Be sure to write this down somewhere on your paper, so that you can easily reference it and that you're using the correct ones. Date of birth, I don't really need to go into that. These next two questions about sex assigned at birth and gender identity don't necessarily need to be asked in the room. So this is something you can include on your intake forms, and then you can reference. But I don't think I would ever walk into a room and ask somebody what it was your sex assigned at birth or what is your gender identity. Just keep that on an intake form. Ask everybody that on your intake form. Allow for an open-ended response, because like I've mentioned in a lot of videos, there are people who are assigned male at birth, people assigned female at birth, and people who are intersex or have differences in sexual development. So it's nice to have just an open space here for sex assigned at birth so that people can explain their situation to you and what they want you to know about that. Same thing with gender identity. Since there are many categories of gender identity, just leave this open-ended so that people can respond with what they want you to know about their gender identity. But then, yeah, you don't really have to reference that in the room with somebody. Chief complaints. So, of course, a lot of this stuff we're going to today just kind of talk about like an annual physical, because for something very focused, like let's say somebody comes in with like a cough, or they come in with abdominal pain, that's going to be a more focused exam and a more focused history. And so we're going to talk about a case where it's just a new patient, a general physical, so that you do get more of these details. Because if something isn't pertinent to the reason why they're coming in, there's no reason to really be asking them over and over again. And this kind of goes into the history of present illness. So if somebody comes in with, I don't know, like a respiratory infection, you don't really need to ask them 8 times about what genital surgeries they had, and you probably don't need to include that in their HPI. But for somebody who's having just an annual physical, that's a case where you do want to take more time to ask somebody about their medical history and what they kind of want out of this doctor-patient relationship, kind of what care they're looking for, and so that you can establish more of that kind of relationship. But in your HPI, it's really important that you take advantage of this space to use correct name and pronouns for people right here. I don't see any reason to use somebody's dead name in your HPI, especially when this is the name that you're going to be referring to them as. And so I'll just give a little bit of example of how I would write this up for somebody who is trans or non-binary. And so let's say we have somebody, we have Sam Smith, is a 35-year-old transgender man presenting with ... So if you're writing this out, transgender man implies that they are transitioning to presenting as male. They identify as male. So you don't need to include anything awkward. Like don't ever say a man who wants to be a woman. Don't ever say used to be female. Used to be. Don't use those terminologies. Don't say born a man. Don't. All you have to include is that they're a transgender man. Can say, let's say Angie Smith is a 25-year-old transgender woman, ... Somebody who's non-binary, let's say we have Sam Smith as a gender-neutral name. Sam Smith is a 15-year-old non-binary person. And that's kind of how you can lead in. You can do the rest of the HPI just the same as you would with any cisgender patient. So hope that helps you there with your HPI. Past medical history. So this is where, of course, we're going to ask pretty normal questions. We don't really need to get a lot into somebody's transness during the past medical history, because we can get into that with their past surgical history and their medication history and all that jazz. So just kind of include this kind of your normal medical history that you'd ask anyone. History of hypertension, history of asthma, etc., etc. Good things that you're going to want to know. Past surgical history. Okay, so this is kind of where we get into talking about any surgeries that they have had. And also, I want to make sure that we ask people about surgeries that they want to have. So when you phrase this question, of course, you often ask them, have you had any surgical procedures done in the past? Or have you ever had a surgery? And we all know what a surgery is, I hope. And so if you just ask us that question and someone has had a surgery, let's say somebody has had a vaginoplasty, they will tell you. They will tell you that they had a vaginoplasty. It's not often that people would just forget the fact that they ever had a major surgery like that. They're going to remember and they're going to tell you. They're going to want you to know and remember the fact that they had these surgeries, because we don't want to repeat this information over and over and over again. It gets very tedious for us. So you're going to include all of the past surgical history. So sure, they might have had a tonsillectomy in 2005. Cool. They might have had a vaginoplasty in 2016. Cool. Kind of list it normally like you would for any other surgical history that you're asking. But another great question to ask here is, would you like to discuss additional surgical options? Or would you like to discuss any surgeries in the future? Are you planning on having any surgeries in the future? Those are some good questions to ask. Probably just pick one. You don't need to ask all of them in a row. But asking if they have plans of getting a vaginoplasty, or if they have plans of getting a phalloplasty, it's great to know. But also there are a lot of trans people who don't want surgeries. And so it's important that you phrase it as an open-ended question. Make sure that you're taking into account the fact that they are not obligated to have these surgeries. So just, would you like to discuss these today? And the answer might be yes, the answer might be no. And that's kind of where you can leave it for surgeries. Prior hospitalizations is how you'd ask anybody. Family history is kind of same stuff. Normal, like you'd ask people about their family history. That doesn't really change for trans people. Social history. I'm going to make an entire separate video about how to ask about social history, and especially how to ask about sexual history, because that comes with a lot of baggage and a lot of stigma. And it's important that we ask, obviously it's very important that we ask about sexual history, but there are ways to do this tactfully and that don't make people feel like you're judging them. So we're going to make an entire separate video about their social history, but do not forget this aspect at all. Medications. This is where we ask about hormones. And so again, it's very unlikely that a trans person is just going to forget the fact that they're prescribed hormones. If someone were to ask me, well, I'm not on testosterone yet, but in 2 weeks I will be. But let's say I'm on testosterone. It's a major part of my life. And someone asks me, are you taking any medications? I'm probably going to remember that I'm taking testosterone. So that is something I would tell them. I am taking testosterone. I am doing intramuscular injection, or I'm doing a testosterone gel. They're going to remember, and they're going to tell you during this time, as long as you ask about their medications, which you should always. But then a good thing to ask here is, very similarly to the surgical history, would you like to discuss options for hormone therapy? And this is great for anyone who's not currently on any hormones. This is a great question to ask them, figure out if they do want hormones. A lot of people don't want hormones. A lot of people do want hormones. So just make sure that you're asking them this question. Keep this in the back of your mind. Make sure, this is really important. Along with the surgical history and this medication history, make sure you understand these options. If you're going to ask a patient if they want to discuss the options and they say yes, be prepared to discuss the options. Of course, if you're not a surgeon, you're not going to necessarily know the nuances of exactly what procedures they'd be eligible for and what you'd do specifically for them, you can at least understand the basics of surgery and be able to communicate what a timeline looks like, what any initial treatment looks like, what are the steps to get them ready to go have a consult, figure out who you can give them a referral to, that kind of thing. So make sure you understand those surgical options and make sure you understand your hormone options as well. Also understand any androgen blockers, understand your puberty blockers, know all these aspects of treatment so that you can give proper advice when it is called for. So yeah, ask them, would you like to discuss options for hormone therapy? And then you can have that discussion with them. If they are currently on hormones, this is a great time to ask them, how do they feel about their current regimen? So if they're already on hormones, do they feel comfortable with the medications that they've already been prescribed? If let's say they're on spironolactone as an androgen blocker, are they comfortable with that? Are they having a good experience with that? Are there side effects they are not comfortable with? Do you want to look at alternative options? Or do you want to work with dosages? That kind of thing is really good to establish. So how do you feel about your current regimen? You can talk with them about all of that. Allergies, this is same as anyone else. Okay, and then this one, if someone was assigned female, I understand, and we all understand, that we need to ask about last menstrual period. We need to ask things about pregnancy and make sure that somebody is not at risk for things such as ectopic pregnancy. So it is very important to ask somebody about their last menstrual period. And speaking from the perspective of a trans guy, I hate my periods. My periods give me the worst dysphoria. It makes me feel like I'm not a man and that I'm not valid. So this is something, yes, you need to ask it, but you need to ask it respectfully. Have empathy when talking with a trans man or a non-binary person about their period. Keep it. I would prefer keeping this very clinical and just asking, when was your last menstrual period? And they'll tell you. But just don't make any assumptions about somebody's pregnancy status, about their ability to become pregnant, desire to become pregnant, any of that, and trust your patients. This is a two-way street. How do you expect a patient to trust you if you aren't willing to give them the benefit of the doubt? If somebody tells you that there's no possibility for them to be pregnant, yeah, I would trust them. There are lots of people who are not in a sexually active situation where they can become pregnant, and a lot of times they know. So, of course, if you think that somebody is not understanding the question, then you need to address your communication and how you are presenting the information. But there are lots of ways that you can ask about menstrual period and about pregnancy with maintaining somebody's respect and while understanding that they are valid and that their identity is valid. So just be clinical about that. Don't make a huge deal out of it. Don't spend a whole lot of time out with this. Just kind of get in, get out, move on with your day. Review of systems. I'm not going to go into that. That's going to be the same as everything else. And so that was kind of a long video talking about the subjective portion of a history and physical. I'm going to make more videos in the future talking about the physical exam itself. And then also we'll talk about how to use medical terminology with somebody who's trans. For example, how to talk about breast exams, how to talk about pap smears, how to talk about prostate exams with a patient. Maybe even, obviously I can't demonstrate those things on camera for you all because that'd be a little bit awkward. But we can talk about how to appropriately approach those kind of exams later on in the future. So I hope that this was helpful for you. And once again, this is just my experience and what I would like to see in the clinic if I were to see a doctor about these issues. So just keep that in mind. Everybody is different. And I hope this was helpful. And let me know if you have any questions. Subscribe to my channel, hit the notification bell, and I will see you all in the next one.